Should start at this point. I see the rate at which people are joining has slowed down slightly, so I think I'll start. So good morning, everybody. You're very welcome to this session on youth mental health in the context of the COVID-19 pandemic. My name is Eilis Hennessey. I'm a professor in the UCD School of Psychology. And I'm delighted to have three of my colleagues from the school here this morning, Professor Gary O'Reilly, Dr. Niki, Nearchou and Nearchou, sorry, Niki, and Dr. Amanda Fitzgerald. And also to welcome Rachael Traynor from the National Youth Council. So the format of this morning is that each speaker will speak for 15 minutes. In each case, they have a PowerPoint presentation, which you will be able to see. And if you have questions arising from their presentation, you may use the Q&A function that should be visible to you at the bottom of your Zoom screen. What we will do is we will ask the questions at the very end of the session. If you're not able to stay for the entire session, let me reassure you that the session is being recorded and you will be able, therefore, to see any bits you've missed or to, indeed, to catch other sessions that you would have liked to have attended as well. So there's more than one opportunity to catch the material that is being presented here today. I'd ask you to bear with us in relation to any potential technological hitches. The technology and this format of presentation is still relatively new to us. There can be problems, so we will try to manage them as we go along, but I'd ask for your patience in relation to that. So without further ado, I am going to hand over to my colleague, Dr. Niki Nearchou from the UCD School of Psychology. And Niki is going to talk to us about the resilience of young people with chronic health conditions during the COVID-19 pandemic. Over to you, Niki.
Yes, so I suppose I just share my screen. So thank you, Eilis, for inviting me to join this session on youth mental health. And today I will talk about ways that we can promote resilience in young people living with chronic illness during this COVID-19 pandemic. So considering the origins of resilience, the notion of resilience, the concept of resilience dates back in the 50s, but it wasn't not until early 70s where we have the first pioneering research on youth resilience. And researchers back then tried to understand why some people seem to develop well despite being exposed to different kinds of risks. So it seems that this notion of gifted and charismatic children dealing with risks was very existent in the resilience milieu. So using at the time terms like invincible or invulnerables. So for example, one of the earliest news articles about resilience that was published in APA Monitor was in praise of invulnerables. And a year later, there was a headline published in Washington Post in an article, troubles a bubble to some kids. So that headline implied that some children could simply burst the bubble of adversity around them and move on. So what is resilience? Drawing from Anne Masten's word and the power of the ordinary, I will just use a statement, a sentence that she used a lot in her writing. So what began as a quest to understand the extraordinary revealed the power of the ordinary. So I think that this is a very powerful sentence that summarizes the essence of resilience. And at the same time, I really believe that is really hopeful. So resilience does not come from special qualities. And at the same time, it offers an optimistic outlook for action. So I strongly believe that this statement captures, reflects the contemporary conceptualization of resilience. So resilience is a dynamic process, a complex process, which supports individuals and young people to undertake a normal course of development, but at the same time to remain functional or return to functional levels, so cope and bounce back despite being exposed to different stressors. And usually these stressors have negative consequences on their physical and psychological well-being. So promoting resilience is associated with normative human resources that can be found in the minds, in the bodies, in the brains of children, but also they are found in the systems surrounding them. So their families, their relationships, their schools, their communities. So if we want to act, we will need to reinforce this adaptational system surrounding the child and foster resilience. So this slide here shows a graph. This graph shows the socio-ecological framework of resilience that rose from the work of Prof. And this is a model that identifies different multi-level systems, as we can see, that interact and influence adaptation under stressful situations. So this model places the child, the young developing person, across a series of nested societal systems, providing access to resources that promote resilience in the face of adversity. And as we can see, these different systems operate at different levels and represent processes of interactions between the child, but also elements identified in this system. So, for example, microsystems usually represent the activities, the roles, the interpersonal relationships, where the child, the developing young person, is directly involved and interact with. And these systems are the school, the family, the neighborhood, the community. And then there are the mesosystemic processes that are associated with resilience. And these represent the interactions between these microsystems. So the interaction between the school and the family, the neighborhood and the school, the family and the community. And the external layer is the distal social interactions. So this is the ecosystem that refers to it, represent these interactions. And these have the potential to promote resilience indirectly. So I will give you an example of what I mean by promote resilience indirectly. So we know from research that providing parents and caregivers with a set of potentially supportive relationships make it easier for them to sustain the provision of child rearing, of the quality of child rearing, especially when they are exposed or they are experiencing multiple and different stressors. So 50 years of, in the 50 years of resilience research, what has been consistently identified as the most important protective factor that promotes resilience in young people, and that includes children, adolescents, and young adults, is social support. So social support operates either directly or indirectly. So it operates directly through the families, the school, the community. So, for example, a positive relationship with a teacher, we know that can be very beneficial for the child, but it also operates indirectly. So we can, for example, support the teacher and provide the teacher with the skill set to establish and maintain a positive relationship with the student. What we also know is that social support is a strong protective factor of resilience under different types of stressors or multiple stressors. And stressors, multiple stressors that we know of, it can be a war, a natural disaster, living in poverty, a pandemic. We have evidence from the SARS outbreak, but also living with a chronic illness. So children and young people living with a chronic illness, we know that they face the same challenges and developmental milestones as their healthy peers. But we also know that they have to deal with the burden of the chronic illness, and usually that entails additional considerable challenges that have negative consequences on their psychological and physical well-being. So, living with a chronic illness or with a disability can impair the achievement of these developmental milestones, but it can also result in limited social life and experiencing loneliness. So, and what we also know is that youth with chronic illnesses living with a chronic condition, they are more vulnerable, they are more susceptible to experience heightened levels of stress, anxiety, and depressive symptoms. So in this slide, I have included 2 quotes from young people that participated in a study during the SARS outbreak that was conducted in Canada. So this study interviewed young people living with a chronic illness. And the age range was from 5 to 19 years old. So it included, the study included young children, adolescents, up to emerging adults. So the first quote is comes from a 14-year-old girl saying that it kind of made me feel sad because I thought that the world was going to end or something. So the question was, what do you feel? And the second quote comes from a 9-year-old saying that sometimes we thought about, oh my God, what happens if I get it? That was kind of scary because you never know, right? So you thought about the stuff you wanted to do and stuff you had already done. So I think that especially the second, that first of all, the emotions that these children experience range from sadness and fear and anxiety and fear of the unknown. But also the second quote, I think it's hopeful because it kind of shows emotional maturity. And we know, so this comes from a 9-year-old, and we know that children living with chronic illness are more emotionally mature than when compared to their healthy peers. So in the next few slides, I will very briefly present some key findings of the Rachael project that I feel and believe that they can be used and can be applied in this COVID-19 situation in terms of supporting young people living with chronic illness. So this project was completed recently, and we examined predictors of well-being and quality of life in young people with chronic health conditions. So we recruited 288 young adults from college further education in Ireland, aged from 18 to 25 years, and their mean age was approximately 20 years. So 54% of them were females, and 43% of them reported being diagnosed with a chronic health condition. This chart here shows the rates of reported conditions. So 42% of our sample reported being diagnosed with a mental condition, 28% with a physical condition, and 31% reported living with both a physical and a mental chronic condition. This next slide shows reported levels of social functioning and emotional well-being. So as you can see, there are 2 groups. So the first, the group with there's a group with the chronic health conditions and those who reported not being diagnosed with a health condition. So the column with the light blue represents those young people that reported being diagnosed with the chronic health conditions. And as we can see, they reported significantly lower levels of social functioning and emotional well-being when compared to their healthy counterparts. So some of the key findings of this project that can be applied and can give food for thought and considerations about how we can support young people and how we can promote protective factors that we know that are associated with the resilience in young people living with chronic health conditions during this COVID-19 situation, is that first of all, we found that social support was really important in terms of predicting better social functioning and emotional well-being. What is unique though is that for these young people, what it really mattered was social support from family, but not from peers or a significant other, which is unique because we know that from other research that social support, especially from peers, is a very important protective factor for adolescents and especially young adults. And the second key finding that it's really important to consider is that self-esteem was also a very strong protective factor that was associated with better social functioning and better emotional well-being. So feeling confident in oneself predicted a better emotional state and better functioning in terms of societal functioning in these young people. So if we link these findings and think these findings in the context of the model that I showed in the earlier slide, what we know is that social support can operate either directly or indirectly. And what we also know from the Rachael project is that these young people with chronic health conditions, they feel that social support really matters to them, is a really protective factor. So if we think this as a distal social system, and we can provide support from parents and caregivers. So subsequently, we can provide parents, families with the skill sets and the capacity to support young people. And subsequently, the young person will feel supported, but through operating indirectly, through an indirect manner. But also we have to consider that self-esteem is a really important factor here, because we know that people who felt they had higher levels, reported higher levels of self-esteem, they also had better levels, reported better levels of emotional well-being and better levels of social functioning. So if we consider this in relation to what we can do now, how can we use these findings in this COVID-19 situation to support young people? So first of all, we know that parents who better supported, from other research, is that parents who better supported their children knew how to navigate in order to get access to support themselves. So knowing what supports are available to them and knowing how to get access to these supports can be a really important factor. So building awareness on existing supports for parents can indirectly result in supporting the young person. And what we also know in terms of self-esteem is that it's a multifaceted construct. So it has many aspects, and two really important aspects for young people are that the more connected they feel with their physical and social environment, the higher the self-esteem. And also it's really important for a young person to feel that they belong. They're part of something, they're part of a youth club, they're part of a classroom, they're part of their family. So it's really important to enhance this connectedness with community, with neighborhood, and also to enhance this sense of belonging in young people. So thank you very much for your attention. And the Rachael report is available freely online in through the UCD repository. Thank you.
Thank you very much indeed, Niki, for that very interesting presentation. So as I mentioned at the beginning, it is possible to ask questions using the Q&A function at the bottom of your Zoom screen, but those questions won't be answered until the end of this seminar. Okay, so we will move on to the next presentation from my colleague, Professor Gary O'Reilly from the UCD School of Psychology. So Gary, over to you.
Great, thanks Eilis. So I'm just going to start sharing my screen here. Okay, so I just want to say thank you very much to Eilis and Orla for organising the session this morning. And I'm going to talk about, is it normal to feel more afraid, angry or sad at the moment? And there's a couple of things that I'd like to kind of cover during the course of the 15 minutes. I just want to begin by thinking about our language choice as we describe the response of our community and our personal response to the COVID-19 situation, and whether there could be some unintended consequences to the type of language that we use and whether that's important or not. The main thing I want to concentrate on is that it's really important to pay attention to how we're feeling, and for us to help children to pay attention to how they're feeling currently. But it's really important that we give them the message that their response to a really difficult situation is normal, that there isn't something wrong if they're feeling more sad or angry or more afraid. And then I'd like to kind of conclude by thinking about what are practical things that parents might consider trying with their children to help them with their response to what's going on. So I want to think about some kind of important emotion regulation skills that people could consider. And that's putting words in how you're feeling, learning how to turn your emotions up and down, and cultivating a compassionate response to ourselves and to other people. And compassion is a word that we see increasingly used in modern society. So I want to unpack a little bit, what does compassion mean? And if we're trying to cultivate a compassionate response in children, what are the kind of things that we might be trying to help them to do? We've seen some really different leadership styles and different language use by our political leaders over the course of the last 2 months, and it's been striking the differences. But they've all been pointed in the one direction, which is this really difficult situation that we're in, where we're trying to prevent people from dying from a disease that none of us have ever heard before 2 months ago. It's a remarkably serious situation that we're in. So understandably, everyone's kind of attention is heightened as a consequence. Are we being successful or not? How do we measure the outcome of that? Is it deaths per million of people in a population? Are we flattening the curve? These are really important kind of things that we're all collectively working towards. And the response of our community, I think, has just been remarkable. I think it's brought out the best in so many people who I suspect were pretty amazing to begin with, whether that's medical staff, nurses, doctors, other medical staff that support them, postmen, Gardaí, people who drive our buses, people who work in supermarkets, make deliveries, or teachers who double as teachers and delivery people. It's just been amazing, I think, to see. And I think how some of our commentators and politicians describe them is interesting to contrast. I see some people choose a very kind of militaristic kind of language to describe their behaviour, that they're fighting an enemy, that we're all at war, these people are on the front line, we're under attack, they're killing the virus, they're doing battle, and they've been redeployed. Whereas I think it may be more accurate to say, well, these aren't soldiers, these are regular people, very professionally going about their job, they're serving the public, they're being scientific, they're practicing medicine, bravely doing their job. Volunteering, supporting our community, and they've been reassigned rather than redeployed. So I think this kind of language for me respects the dignity of what these people are doing more than a militaristic type of language. So I think we should have some caution about how we describe what they're doing. And I think another message, which is a really important message that we need to be a little bit careful of our language, is this very important message that we need to mind our mental health during COVID-19. And we see this very helpfully, prominently displayed in our health service and through our media, that we need to mind our mental health. The aspect of this that I think we need to be cautious about is, what's the message that we give to people if we identify that someone is struggling in responding to COVID-19? So if I would like to mind my mental health during the COVID-19 situation, but I notice that I am more anxious, that I'm more sad, that I'm angrier, that I'm drinking more, that I'm sleeping more, that I'm drinking less, that I'm more irritable, I'm more traumatized, does that mean that there's something wrong with me? Do I now have a mental health problem or a mental illness? Or should I really be thinking of this in terms of that something really important is happening to me? I need to pay attention to what I'm doing and how I'm responding and what I'm feeling, but I have a big normal emotional response to a very big stressful event. So I think we need to be just a little bit careful of our language here when we give that message about mental health. Our response is a normal one. And our emotions aren't a mental health issue. Our emotions are normal, they're functional. So each of our emotions has a very important, distinct purpose. So for example, the purpose of anxiety is to warn us that we're in danger and that we need to act to protect ourselves. The purpose of sadness is to draw our attention to the important things that we've lost, to allow us to grieve those things, to process that loss. And it signifies to us who or what is important to us. The purpose of anger normally is to defend ourselves, to maybe punish or respond to unfairness and injustice. So we do need to pay attention to these emotions because they're telling us something important about the situation that we're in, and they're uniquely telling us that. Another aspect of emotions is that they have a shared function. Their function is to rapidly direct our behavior towards a response and to communicate to others our mental state. Emotions are an incredible way to communicate to others. I'm sure people have had the experience of walking into a room and picking up a vibe in a room. No one has said anything, but you pick up the emotional tone that something has happened in that room. So these are really powerful situations. They tell us something very important about ourselves. And they've evolved to do that. So we're in a really threatening environment like we're in now, where COVID-19 is a big dangerous thing that's happening to me, my family, my friends, my community. Some aspects of my brain are evolved to respond to that threat emotionally so that my body responds to protect me from that threat. This is a really important function of our emotions that they're normally meant to do. But we're in a situation that's very different currently. We're in a situation where people are dying, where we are collectively trying to protect our community. So our emotions are going to be enhanced because of that. They're going to be heightened. So it's very important that we pay attention to that heightened message that they give us, that we understand that, and we learn how to regulate and process those heightened emotional states that we're in. And this is one of the difficulties with our emotions. Our emotions are evolved for a short-term response to a threatening environment. They don't work quite so well when we're in a prolonged situation of threat, like the one that we're currently in. And that's where things will become a little bit more problematic, and we may need to mind our emotional state consequently. So this is one of the important points that I'd like to try and make. Minding my mental health requires me to use other parts of my brain to regulate my emotions at these types of heightened emotion. So there isn't something wrong with you if you're feeling more anxious, worried, or afraid something important has happened to you. I kind of think it's kind of like we've been driving a normal road car for most of our lives, and suddenly now we're in a situation where our emotions have turned themselves into a highly tuned Formula One car, and we need to learn to drive that a little bit differently in order to drive it safely. And I think that's the kind of situation that we're in currently. So how might we do that, and how might we help children to do that? And there's three things that I just kind of like to kind of mention that might be helpful in that regard, that we can teach children how to do, or even practice for ourselves. The first one is to put words on how you're feeling. The second is learning how to turn your emotions up and down. And the third is to cultivate a compassionate response to the situation that we're in. So the first one of these skills, very simple skills, is how to put words on how I'm feeling. A skill that I usually use clinically when I'm working with young people and we're thinking about their emotions or helping them make sense of their emotions is this skill which is called using I statements to express your feelings. And an I statement has three parts to it. It starts by letting people know whose feeling we're talking about. So we just say, I feel. The second part of an I statement is you help the young person to clearly label what that feeling is. So I feel happy, I feel sad, angry, frustrated, lonely, whatever that may be. And the third part of an I statement is that we try and explain to ourselves and other people why we're feeling that way. So I feel sad when I can't call to see my friends because I miss them. Okay, so we help children to use that structure of talking about their emotional states. Children and adults feel a huge range of emotions through the course of any regular day, and particularly at the moment, I'm sure we're feeling lots of these in a heightened sense. So we can look out for those opportunities that naturally arise in a child's life during the course of their day, when we notice that they're feeling a certain way, and encourage them to put words on what it is that they're feeling. So we can kind of use that I statement structure and help a child put words on their feelings. So that's a natural opportunity that arises for us to do that. If you're like me and you're working maybe in a clinical setting with children, you tend to be doing this retrospectively. So again, we could consider doing that at the end of the day or after an event has passed. I tend to use worksheets that look something like this. We'll think of a particular emotion and we'll name what that emotion is, and then the young person will encourage them to think about a time when they've experienced that emotion. They can tell me about it, they could draw a picture, they could write a story about it. And then we'll think about how intensely did they feel that emotion on a scale of 0 to 10. Then we'll think about physically, where did they notice that emotion in their body? And then we put that all together and we use an I statement to express how they felt in that situation. So I felt afraid because I heard something in the news about people dying. So we can kind of retrospectively do this with children as well, if we think it'll help them to make sense of what they're experiencing. An understandable fear that sometimes parents and adults have is, will I make things worse if I draw my child's attention to what they're feeling? Wouldn't it be better if we just kind of left well enough alone and let them get on with it and they'll sort it out by themselves? The evidence seems to suggest the opposite, that actually if we ignore children's feelings, we actually turn them up and we heighten their emotional state rather than turning them down. Whereas if we draw attention to what it is that children are feeling and we validate them and we put words on what it is that they're feeling, that we help a child to regulate what they're feeling. So it's good to pay attention to how children are feeling. We're in a unique situation currently with the coronavirus. There are lots of really nice resources out there on the internet. Alan Carr, who's a professor of clinical psychology at GCD, sent me this morning, and it's a book about explaining the coronavirus to children, and it's illustrated by Alex Scheffler, who's the person who illustrated the Gruffalo books. So this is a nice resource that parents can download for free and use with children as they talk to them about what's happened, and maybe use that as an opportunity to talk to children about how they're feeling. So that's the first simple skill. The second one that I'd like to think about is turning our emotions up and down. And so when we're feeling, we have an emotional response to something that's normal, that's good, but if we're experiencing that emotion over a prolonged period of time and we want to mind that emotion, it may be helpful for us to learn how to turn that up and down. So some emotions like anger or fear, we might want to learn how to turn down. And there are evidence-based ways that we can teach children simple skills to help them with this. Two that have a huge amount of evidence behind them are teaching children how to use simple breathing techniques to regulate themselves and to use a relaxation called progressive muscular relaxation. So on the screen here, there's an app that's available for free on the iTunes and Google Play stores called Mindful Naps, and it has breathing exercises and progressive muscular relaxation and other mindfulness exercises there. So I tend to use that with children, and you can see from what's the illustration here on the screen, the breathing exercise, for example, is really simple. It's simply, we look at this little creature on the screen and we follow the pace of his breathing, and children can play around with different paces for children as they find the pace that works helpfully for them to regulate their fear and their anger, so they can kind of turn those feelings down. And muscular relaxation is simply you tense your muscles working right through your body, and then you let them go and you notice that change from tension to relaxation. There's also a website, if you don't want to use an app on a phone or an iPad, that you can use with children, which is all called mindfulness.com, which has those exercises on it as well. And I was just so impressed when I saw this on OTE's Homeschool Hub. This is a teacher teaching children how to do progressive muscular relaxation as part of their school curriculum. So that's available for all of us to go kind of and watch on the OTE player. So I think fair play to OTE for that. So these are simple tools that we can use. Sometimes we might want to help a child learn how to turn their emotions up. So if someone is feeling sad for a prolonged period of time, we might want to help them to notice and to turn up their positive emotions. And the evidence-based approach to this is called behavioral activation, where we help a child to think through, what are the things that I'm doing less of now because I'm feeling sad and unmotivated, and which of those would I like to begin to increasingly do and experience some increase in positive emotion as a consequence. So I tend to use worksheets that look like this. It's important to start with what's going to motivate the person to engage in this kind of exercise. So I would talk to you, a person, about what kind of person would you like to be? What kind of family member would you like to be? What kind of friend would you like to be? What are the things that give you pleasure in being that kind of person? And what are the things that give you a sense of achievement as you are that kind of a person? So we get them to make a list of the things they enjoy doing and the things that are helpful to do as they become that kind of person. And then they pick which one would they like to do, and they measure how well they get on with that, thinking about how much pleasure do I get from that, how much sense of mastery do I get from that. And they use that to learn for themselves, what is the pace of change to increase my positive emotions that I can experience in doing that. So the child is always in control of what they're doing and learning from their own experience of that. So finally, just to mention cultivating a compassionate response. And this use of compassion has become increasingly popular in modern parlance. And a lot of it stems from this work of Professor Paul Gilbert in the UK, who defines compassion in a form of therapy called compassion-focused therapy, as sensitivity to suffering of self and others with a commitment to try to relieve it and prevent it. So if we're being compassionate, we require having a sensitivity to other people in our lives and our own emotional distress, and some wisdom in how we respond to that, courage and strength within that response. And we need to be practiced and dedicated in our use of compassion. That alarm is telling me my 15 minutes are up. I'm sorry I don't have a little bit more time to unpackage this, but hopefully that gives you an introduction. That it's a longer arc in terms of developing a compassionate response that requires some careful thought and some practice. So I'm going to stop there, if that's okay. So back over to you, Eilis.
Thank you very much indeed, Gary, for that very interesting presentation and for all of the practical tips that I am sure lots of people will find extremely useful. Just to remind anybody who joined us during that session that it is possible to ask questions using the Q&A function that you will see at the very bottom of your Zoom screen. Questions are in text only, and we will answer them at the end of the session today. So it's possible we won't be able to answer them all, but I will read out some of the questions and we will answer them. So the next presentation now is Dr. Amanda Fitzgerald from the UCD School of Psychology. And Amanda is going to talk to us about some of the findings of the My World survey and their relevance for our understanding responses of children and young people in the current crisis. Over to you, Amanda.
Okay, I'm just trying to share my screen. Is it sharing there? Hello?
It's not sharing yet, Amanda.
Okay. Just going to try again. It just said failed there that time when I tried to share, but let me try again. I'll try now.
Perfect. We can see it now. If
Okay,
you just go into
great.
the presentation mode.
Yeah, great. So hello everyone. Thanks very much for attending the talk today, and I'm going to follow on from Gary, where I'm going to focus particularly on some key findings from the My World survey. Which really focuses in today on adolescents and looking at risk and protective factors related to their mental health. But what I've tried to do for today's seminar really is to try and take some key findings that could inform the current situation, how we could support adolescents during the coronavirus situation. So just this research, the PI in it was Professor Barbara Dooley, Clean O'Connor was the postdoc, and Aileen O'Reilly is Jigsaw Research Manager. So this project is a collaboration between the UCD School of Psychology and Jigsaw, the National Centre for Youth Mental Health. So I'm very briefly going to touch on the methodology, but just to give you an insight to how it was conducted. And then I'm going to focus in particular today on the data on adolescents, and then how these findings could inform how best to support young people during the COVID-19. Why is this research important? Well, the current My World survey is called the My World Survey 2, and we published this report in 2019. And prior to that, we conducted the first My World survey back in 2012. So it's been about 8 years since the first piece of research was conducted. And as a result of conducting a repeat survey, we can now look to see are there increases or decreases or no changes in certain mental health indicators or risk and protective factors. So I'll talk through what some of those are. And we know that the development of mental health difficulties often emerges in adolescence and early adulthood. And if we can intervene at this time, then it's really important. We can support a person before the issues might become more manageable. And this research, we consulted with young people about the issues that were important to them. And from the first My World survey, things like social media were much more important to look at. Things like gender identity, sexual orientation, and lifestyle behaviours like physical activity and sleep. We haven't captured those in the last My World survey. They identified these were important. And this research informs development of policy and practice. So with Jigsaw, some of you might have heard about the One Good Adult campaign that's launched in Lidl across Ireland. And the key finding from this research on the One Good Adult informed the development of that campaign. We looked at a whole host of risk and protective factors. And by a protective factor, what I mean here is what factor could potentially support a young person going through difficult times, or potentially buffer or protect them from developing more symptoms of distress. And a risk factor is a factor that could challenge a young person's mental health, so increase the likelihood of them experiencing difficulties. And today I'm just focusing in on the adolescent sample. We had over 10,000 young people. And the important piece about this research is that it's a community-based sample of young people. And we had over 10% of all post-primary schools in Ireland took part. And our sampling frame is reflective of the national distribution of schools in terms of disadvantaged, non-disadvantaged status, gender composition, having at least one school per county. And it's also reflective of the CHO, the Community Health Organisation areas. We had 56% females. We have also conducted this research with young adults, 18 to 25-year-olds, and then seldom heard groups such as those in Youth Reach, enrolled in early school leaving training programs, the College of Further Education, and those with physical disabilities. But I'm just focusing in on the adolescent data for today. So the 5 key findings I'm going to look at, first of all, is anxiety and how there's I suppose, an increase in anxiety, and then what that might mean, particularly in light of Gary's comment there that, it isn't normal to experience feelings of anxiety now. I'm going to look at some protective factors that might inform people how we can support a young person's mental health during this time. I'm also going to look at the role of the one good adult, which is a key finding. Lifestyle behaviours and lifestyle factors. We know that routine has changed now for young people. They've less routine, and what lifestyle factors have been shown to be associated with potentially better mental health outcomes. And then young people accessing mental health supports. There are some young people who will want to reach out and access supports, and some key findings on that. So just to comment from the first My World survey, in this 8-year period, we do see increases in anxiety using the same measures. And our measure of anxiety looks at the core features of anxiety, such as feelings of panic without no reason, heart racing, a sense of worry. And when we look at our anxiety, what we see in the My World is that it has increased for those who are in the severe and very severe category. It's gone from 11% in 2012 up to 22% for adolescents falling into these categories. And when we break it down by gender in the current My World survey too, we do see that gender difference that people would be aware of, where we see that 28% of females were falling into the severe and very severe categories for anxiety, where this was about 15% for males. And if we think about anxiety, it is likely to be further exacerbated as a result of COVID-19. And anxiety is coming up as a concern amongst young people at the moment. And it may be generalized anxiety about the uncertainty of the pandemic, when are certain restrictions going to be ended. But also might be anxiety about specific issues, missing their grandparents, missing their friends, worried about getting a summer job. And also we need to take into account that some young people will have pre-existing mental health difficulties, and there is evidence to suggest that those who have pre-existing mental health difficulties are likely to be more vulnerable to developing anxiety. So it's important that we are aware of that. In our My World survey, we asked young people, what are the top stressors in your life? And the stressors really are a feature of where they're spending their waking day. It's school, exams, and homework, along with other things like relationships, parents, family, and money. And if we think then about what are the current stressors that young people might be facing during COVID-19, well, again, it's going to stem around those issues that are most salient to them, such as exams in school, or even now, for some young people, it's about maintaining themselves to be healthy so that they can actually do their exams. Other issues that are coming up for young people include fear of infection, loss of loved ones, their own mental health, supporting other people's mental health, also an uncertain future. And for an adolescent, that might be something for them like actually getting a job during the summer, but it could also be about their parents' employment status, or loss of a household income, or caring for their loved ones. Impact on their social life and not being able to be in groups, when we know that social development is core to adolescents' development. And loss of usual routine. And what the research says is that social isolation, loss of your usual routine, loss of those social and physical contacts can cause frustration and boredom, and this can cause distress in a young person. And we also ask young people, what are the top 3 ways in which you cope? And for them, it's their friends, sports, exercise, and music. We need to be aware that the typical coping strategies for a young person now are likely to have changed. So if it was that you went out of your house, you met up with your friends face to face, That's changed now. Or if it was that it was sports or participating in a team activity or going to the gym, again, the normal or typical coping strategies for a young person may have changed. And it's about thinking for the young person what coping strategies could now help them, or in what way could they alter their coping strategies to still support them. We looked at a whole host of risk and protective factors, and I'm really just touching on some of them here. I suppose the main point I want to highlight here is that we see certain increases from the first My World survey in protective factors, and we see also certain decreases. So for example, we see that there's an increase in young people reporting problem-focused coping, where they make a plan with how to deal with their problems. There is an increase in support-focused coping in males, which is really positive, so that they're likely to reach out to their friends to get support. We also see that there's an increase in young people saying that they have a special adult when in need. And then there's also certain decreases. So for example, a decrease in level of optimism, a decrease in level of school connectedness. And these changes are small, but the key point that I want to make about these protective factors is that we see that all these protective factors, whether it's resilience, a problem-focused coping, self-esteem, as Niki had mentioned, good school connectedness, are linked with better mental health outcomes. So it's to consider how these protective factors are available in a young person's life and how they could support them. So the protective factors that we're looking at is this sense of self. So your sense of self-worth, your sense of optimism about the future, your sense of personal hardiness or competence, how satisfied you are with your life, your cognitive evaluation of your life, but then also things like the supports around you. We asked young people, do you have a special adult in your life when you were in need? And 76% say they have the one good adult. And just to identify who that one good adult is, the one good adult is typically, they say it's their mother or another family member, followed then by other people. What's important to note here is that about 13% of young people say that they don't have a one good adult. So if we think about now at the moment in terms of COVID, that there's 1 in 10 young people saying they don't have a special adult when they're in need. So it's important to consider how can we reach out and engage with those young people. We also see that the one good adult was linked with higher resilience, higher ability to reach out for help when they need it, higher optimism. We also see that those who have low support from one good adult were more likely to experience increased symptoms of depression. So we see this relationship, and we are proposing that one good adult it could be a key protective factor in a young person's life. Moving on then to lifestyle factors and behaviours, we know that young person's routine has changed, and now they mightn't have the daily structure that they had in the past. And as a result of that, their sleep patterns may shift. And what we see in our research is that about half of young people are getting the recommended sleep based on the guidelines. The US National Sleep Foundation says it's for adolescents, it's about 8 to 10 hours a night. So about half of adolescents are getting recommended sleep. But we see that if they're not getting the recommended sleep, we do see increases in their symptoms of anxiety and depression. And we also see, in particular for females, if females were not getting recommended sleep, they were more likely to be experiencing moderate symptoms of anxiety. If males were not getting sleep, they were falling into the mild category of anxiety. And we also see similar patterns between sleep and symptoms of depression as well. Physical activities, we also see that relationship between those who are engaging in physical activities and better mental health outcomes. So what we see is that about 76% of young people say that they are regularly, which means at least once a week, playing sports in the past 6 months. And those who are participating in sports experience lower depression and anxiety than those who didn't. And again, participating in other activities or hobbies or volunteering was also linked with better mental health outcomes. Just moving on then to social media, we asked young people about social media in this research, and what we see here is that 96% say they have a social media profile online. The typical platforms that they're using is Snapchat and Instagram, and a more recent report that came out during COVID showed that these are the platforms that they're using, but also House Party and Zoom are becoming important for them, where they can interact with different groups of young people. And what we found from our research is that about 1/3 of young people are spending less than 2 hours online, about 1/3 are spending 2 to 3 hours online, and then about 1/3 are spending 3 or more hours online. And what we found from our research is that there is a relationship between time online and anxiety and depression. So those who are spending 3 or more hours online are more likely to fall into the very severe category for anxiety. And it's not that we want to create this heightened anxiety about young people being online. It's, I think, to be aware about it, that there is a relationship here. And other studies are showing that the amount of time a young person spends online, well, it's not that being online is going to necessarily cause symptoms of anxiety or depression. But by being online, you might be being exposed more to, for example, cyberbullying, or you're looking at appearance-related images, which could potentially have an impact. Also, what we do see from our research is that if you're spending more time online, it's displacing other activities. You're less likely to be doing sports or getting good sleep. And these factors, which we know are protective, may have an impact. But we also need to consider that potentially if you're feeling down or not good, you might spend more time online as well. So we can't determine that causality, but it's just something to reflect on. And we know that social media is a crucial part for young people's lives at the moment, when it's a way that they can actually interact with young people's lives. And also another interesting point I want to highlight here is that those who are spending less than 2 hours online did show better problem-focused coping, better optimism. But also what was interesting here is that compared to the young people who spend 2 to 3 hours online, these young people who spend less time online had lower perceived supports from friends and also lower support-focused coping. So we can see here potentially for spending a certain amount of time online, you are getting that support from your friends, interacting with friends, which is interesting as well. Finally, then, we ask young people, do you talk about your problems? And 60% of young people say, yes, I talk about my problems. And we do see that talking is linked with better mental health outcomes. But we also ask young people, which of the following places would you go to for information or support about your mental health? And typically young people are going to go to those informal supports, their parents, their friends, their relatives, followed by online sources of support. And then the formal sources of support that they're likely to use include the doctors, the teacher, the guidance counsellor, less likely to use the phone helpline. And I suppose the point I want to make about this in light of COVID is that there are some young people out there who may want to reach out for help beyond the informal supports. But one thing that's coming up is that they're feeling guilty, or that they're a burden, or that their worries are not as important as someone else's. And it's important that we encourage young people to reach out for that help if they feel they need it. And in line with what Geary is saying, it's important that to acknowledge the young person's feelings, not to ignore it, and to tell them that their feelings are valid. And also that if they reach out earlier, they can often get the help, and it can be when it's more manageable. So that's also important. And also they're more likely to use the online than the phone helpline. So thinking about the online sources of support that are out there, there are excellent online supports now, and many of the face-to-face services have transitioned to online. So just to wrap up here, in terms of the key findings and how it can inform us, we know that staying connected with friends is so important for adolescents. It's really important. Their friends can be an excellent source of support, and social media plays an important role here. The role of one good adult, how we can be there for the young person. If they say they have a special adult in need, when they're in need, then it's linked with better mental health outcomes. But to also consider the young people who say that they don't have a special adult in need, and how we can link in and touch with these more potentially vulnerable young people. Some level of routine is helpful, and potentially could reduce boredom and distress. And it might be about implementing some or encouraging some activities that the young person enjoys. We know that physical activity is beneficial for mental health. Again, it's about encouraging young people to engage in activities that they enjoy. Managing social media habits. Social media is important, potentially limiting social media intake, also considering for a young person if there's certain conversations that aren't actually beneficial. Also, what's coming up at the moment is young people feel a huge fear of missing out, but also just to realise that some social media platforms are curated, and also picking up the phone sometimes can be beneficial for a young person in terms of connecting with their friends. And finally, about the mental health supports, that for young people, the first point of call is often those closest to them. So just for people to be aware about a young person, how they're feeling, and link in and touch base with them on that. So that's it. So thank you very much.
Thank you very much indeed, Amanda, for that very interesting presentation. And it shows us how useful it is to have these large data sets to help us understand young people's mental health at any time. So our final presentation this morning is from Rachael Traynor, And Rachael is going to talk about mental health in the youth work sector, which of course is particularly relevant at the moment. So over to you, Rachael.
Yeah, thank you, Eilis. Just trying to share my screen.
That looks good. If you want to put it into presentation mode.
Yeah. Okay. So this morning I'm just going to highlight kind of mental health in the youth work sector, and it'll be the needs and issues kind of identified by youth workers for young people, but also identifying the issues and concerns for the youth workers themselves. Just to give a brief on the National Youth Council and the Health Programme. The National Youth Health Programme is a partnership between NYCI, the HSE and the Department of Children and Youth Affairs, and we have 4 kind of pillars of work. We build the capacity and sustainability of health promotion within the youth sector, so we would support the youth workers to build their capacity, their skills, their knowledge and their abilities. We advocate on issues that affect the health and well-being of young people, so we would always be collecting the needs and the issues and highlighting them to policymakers and strategy makers. We would develop and promote a culture of health and well-being, so we have an award called the Health Quality Mark, which really awards and highlights youth organisations who have embedded health promotion within their settings. It's taken a holistic approach. And then we act as a conduit between grassroots experience and the development of public policy. So we feed up the needs to the policy makers, but then we also feed down what governments are saying to the grassroots level. So that's kind of our 4 pillars. With 51 member organisations, but we also work with more organisations. So in turn, we're working with over 380,000 young people. So when we're supporting their needs and health and well-being. And this is the framework that we base all of our work on. So in the centre, we have the young people's health and well-being, and then breaking that into the different dimensions of health. And then we also look at the youth work sector, and we look into their NQSF, so what they report into their core principles, and we make sure that everything we do is in line with that. Then we look at the youth worker themselves and how we develop their competencies. And then we take that holistic approach and we look at the organisation, their ethos, their value, and how really we can embed health promotion and make it a holistic experience for young people to experience good health and well-being. So a lot of our work is based on strategy and policy, and we would have a remit in implementing the National Youth Strategy and the Better Outcomes, Brighter Future. And identified in those 2 strategies and policies is specifically health and specifically youth mental health. So we would align a lot of our work to try and implement these on the ground with the youth work sector. So just kind of highlighting a few things, and I'm going to specifically talk about Mind Out, which is highlighted there. But when the National Youth Strategy came out in 2015, the health programme conducted a rapid needs assessment in terms of mental health, just to identify what the needs were, what the youth work sector needed, and what we could do to support them. Falling out from that, there was a signposting tool which was developed, which is an online resource that anyone can access with all the mental health supports available throughout the country. And we've actually spent the last few weeks updating that to include the online element of those services. We deliver the assist, we deliver the Mind Out, we deliver Understanding Self-Harm, which is a training developed by the National Office for Suicide Prevention. And then we also have a specialist certificate in youth health promotion, which is in partnership with NUIG, which allows youth workers to complete the course and really get the foundations of health promotion. And then they bring the learning back into their organisation to start to take that holistic approach on health. So the Mind Out is our 2-day training on mental health promotion. It was developed in partnership with the HSE and NUIG. So NUIG would actually conduct feasibility studies just to make sure that what we're trying to achieve with Mind Out is reached. And basically the Mind Out aims to build the capacity of the young person to develop their core competencies, so their self-awareness, their self-management, their relationship skills and decision-making skills. So it's these core competencies that if they're not developed within the younger years, moving on throughout life, if there's still not skills that that person has, it's going to be very hard for them to transition from kind of different elements of their life. So that's what the Mind Out aims to do. So before organisations and youth workers can actually implement the Mind Out, the young person will actually conduct a self-needs assessment just to identify what their needs are and highlight it to the young person. So it's broke down into 5 categories. You have your internalising behaviours, your externalising behaviours, your social relationships, you're dealing with problems, and the future. So the young person will ask themselves questions and they'll rate themselves between 1 and 10, 1 being you really need to work in that area, or 10 is I'm feeling fine with that area. So each young person will conduct and complete that needs assessment wheel, and then the youth worker will use the findings to actually develop their programme and run the programme. So this is just a picture of kind of the different modules that's within the programme, and as you can see along the top, it has the core competencies that we're trying to develop and we're trying to build, so they're the life skills. And then down the left hand side you have the needs theme, so what they have actually kind of marked themselves on. The self-awareness module is actually a core component within all the sessions that a youth worker will do, because it's given the young person the skills to identify their emotions, understand their emotions, learn a wee bit about themselves, but also boost their self-esteem and confidence and really promote that self-esteem element within the young person. So within all our trainings, we were working with youth workers on a day-to-day basis, and what's happening on the ground really kind of directs our work. So within all our trainings, we ask kind of these 3 questions. What are the issues and concerns in relation to young people and their mental health? Because it's important for us to know what's going on the ground, so we can feed that back up to the policy makers and the funders and say, like, this is happening, how can we support the youth work sector? What is your role in relation to young people and their mental health? And what organisational supports, guidance, policies can support you in this work? So I'm just going to focus just on question 1. What are the issues and concerns in relation to young people and their mental health? These findings come from, they're anecdotal, they're from the youth workers themselves, so they're really important for us to find out. But the findings have been from 2019 up until March, before the restrictions were put in place. We were training right up until then. And we can theme the findings from the issues and concerns into these different kind of categories. So the issues and concerns arising from young people themselves, so what the young people are actually telling the youth workers. Issues and concerns arising within families, so what's going on at the home, are they within safe home environments? The wider issue of mental health, issues and concerns in relation to social media, and then in relation.
We've lost you there, Rachael. Rachael, can you hear me?
They couldn't label their emotions.
Sorry, Rachael, we lost you for a few minutes there.
Oh, I'm back now, am I?
Back now, yeah. Maybe
Yeah,
just a couple of sentences back. Yeah, no problem.
Yeah, I'm just highlighting some of the things that were coming up for the young people. So their inability to explain how they're feeling, how they were communicating their emotions. They didn't know how to label them, and they couldn't deal with their emotions, which was really causing them to act out, and it was showing challenging behaviours for the youth workers, which they were finding really difficult in trying to support that young person. Poor diet and poor sleep hygiene was also a factor. So, and then putting on top of that drugs and alcohol use. So the poor sleep, and then in combination with a really poor lack of diet, like the monster drinks, the high energy drinks, it was really causing the young person to be really irregular and not having a good routine. The isolation and the lack of connection. So because young people are spending a lot of time online, which has its pros as well, and they were communicating online, they actually lost the ability to be able to communicate face to face. So they were finding it really difficult to try and build relationships and build friendships because they actually didn't have the ability to have that communication face to face. It was all online. So it feeds into their self-esteem, their confidence. Like, they didn't have the confidence to have a conversation. You had then the cyberbullying and bullying, which is 24/7 for a young person. And then you also had that pressure. So it was peer pressure, it was school pressure, it was family pressure, but then you also had the pressure of maybe a young person was accessing harmful content online in relation to pornography, and then they were having pressure from the sexual health element of how to perform and knowing how to perform, all of these kind of pressures that were coming in on them as well. So there's a lot of things going on for the young person. So then, since the restrictions were put in place, we've continued to speak to the youth workers on a day-to-day basis just to try and make sure and support them in what's going on. Now, the issues and concerns that are arising from COVID have been there before COVID, but I suppose they've just been highlighted more and brought to the fore more. And I've kind of broken down the needs and issues into two separate. So you have Dublin specific. There's a lot of youth organisations and youth services within Dublin, and then you have the rural, so looking outside of Dublin and what the issues have coming up there. So for Dublin specific, access of technology, a lot of the time households actually don't have the technology or just have one piece of equipment per family, or they're sharing the equipment, so the young person can't actually engage with their youth worker like they would have within the youth organisation. The lack of self-esteem and self-confidence. So Zoom is a big thing that youth organisations are using, but the youth or the young people actually won't turn on the camera because they don't want people to see them. They have really low levels of self-esteem because of this. So it's just bringing all of this to the fore. They're staying up late and sleeping all day. No personal space, so they've no personal space to do their work, they've no personal space to socialise and use the different apps because they're living in a small environment. They're witnessing a lot of high levels of domestic violence in the home, and it's having a major impact on them. But then because of their behaviours, their levels of violence has increased towards the parents and their family members as well. They're accessing inappropriate and unhealthy material, and I suppose this is probably a big concern for us because it is 24/7 now, because we are using the online space. They are probably accessing it more than what they would have, and sexting has become a big issue, so people sending messages, you in receivership of them, so what's going on for you as a young person then? And then you have your physical health, not being able to get outside and exercise as you would have, not being able to attend your football, your clubs and different things. And then in the rural areas, again, it's similar. Anxiety around school was a big thing, not knowing when they were going to get back to do their exams, maintaining their relationships and their friendships, so how they're interacting. Poor Wi-Fi seems to be a big thing within the rural area. But what really is coming up for us, and was always there, that it's the health inequality piece. It was always evident, but I suppose since COVID and since the restrictions have come into place, it's becoming more and more prevalent. So it seems that young people who have families who have good resources, good technology, good Wi-Fi, plenty of space, good relationships with their family, good relationships with friends, good support networks, seem to be getting on much, much better than those young people who actually don't have any of those supports. So it's just highlighting that to us even more, and it is a worrying trend because we don't know how long this is going to go on. And then we also look at the needs and issues of the youth workers as well, because we believe if the youth worker themselves doesn't feel supported and isn't getting the support they need, it's very hard for them to support the young person as well. And we've broken that down into the personal issues and concerns and needs for that youth worker, but then also their issues and concerns towards the young person as well. So for our youth workers, similar to ourselves probably, it's that message of it's hard to keep positive and upbeat when you're working with the young person, and you're dealing with how you're feeling in this. It's difficult to manage a project and staff as well as supporting yourself. Your priorities have changed. You know, you have a family around you now and you're working from home, so there is that need for flexibility, but it's very hard for youth workers to switch off at the minute because young people are trying to contact them maybe 24/7, and before this that wouldn't have happened. You would have had your contact within the youth service and that was it. So it's very hard. The boundary space for youth workers is very difficult. And then just having that frustration and the redeployment. Some youth workers have actually been redeployed to maybe services, homeless services, residential care services. So they have that worry as well, and trying to gain the experience to really help out in those services. And then you have the worry towards the young people, similar to what the needs were before this. It's the cyberbullying. What was coming up was that anticipation of needs for young people. So we all are kind of aware that leaving and coming out of COVID, there's the potential of another recession. So for young people, it's that worry of, am I going to get a job? You know, what's going to happen to me after this? So there is the worries and the needs and issues are there. And I suppose the question that we would have now from the Youth Council's perspective is, what are we going to do to try and support that moving forward? So we have all of our programs and our trainings already there, which we will carry out with, but it's going forward, how do we support that young person and the youth workers to try, and it's really building that self-esteem and that confidence piece coming out of COVID. So that is that. Thanking you.
Thank you very much indeed. Just bring myself back visible there, and thank you indeed to all the presenters this morning and to everybody who has stayed with us. Now, most of the questions that were asked on text during the session have been answered. However, I'm not clear whether everybody's able to see the answers, so I might just ask people to comment on very briefly on some of the points that were raised. One person raised the issue of young people staying in bed during the day and gaming all night. I'm wondering briefly, Gary, would you have any advice in a situation like that?
Yeah, I think this is an understandable concern, and I think there's always that tension between young people love gaming, and it's a very pleasurable thing to do, and also there's a really nice social connection to gaming for young people as well. They can connect up with friends or make friends or be part of a gaming community. So the first thing I think is that it's important that we don't forget those positive things about gaming and why young people like gaming so much, and that we allow young people to game. And I think it's when it turns all night every night and then all day is in bed that clearly that's too much gaming. When I'm working with families and this is an issue, the families are usually really understandably really worried about. And I think what the best solution is usually for parents and the young person to negotiate a change. And that's for the parents to acknowledge with the young person why the gaming is so important and so enjoyable, and to make room for some gaming, and to negotiate with a person maybe different times to engage in their gaming, and also a reduction in the amount of gaming that they do. And the other ingredient that seems important in that is that the parents and the young person would agree positive replacements that the young person is going to do instead of their gaming time. So it might be things like, and often families want it to be something that they would do together. So maybe there'll be a TV program that they'll watch together, or maybe there'll be a games night, a board games night that they might have together, or a meal that they might share together. So I think it's usually, the solution is usually a negotiation.
Okay, that's very helpful. Thanks, Gary. Niki, I noticed a question here for you, and I know you have written a fuller answer to this, but in case other people are interested, someone noted that your talk mentioned social support from peers not as important for family, and would you want to comment on the particular context of that?
Yes, so it's really important when we consider this finding to put them in the right context. So social support wasn't that important from peers, wasn't as that important as was social support from family, but only for young people living with a chronic illness. And we know that these young people have faced different challenges. So staying at home, for example, so imagine that a young person who, let's say, that has a long-term chronic illness will have to self-isolate even within their own house, at a room. So don't have to get in contact with other people. So it's very different for a young person with a chronic illness and for a young person, for an adolescent that is just, the schools are closed and they have to stay in. So we have to consider that this in terms also in the sense of connectedness. And it's really important that if these young people feel that they are connected by talking with their peers, then I don't see why that won't be beneficial for them. So essentially what I'm saying is that we don't have to assume that these findings or what we know for young people with a chronic illness does also apply for all young people from all ages and at all situations. That's really, really important.
Thank you very much, Niki. Yeah, so you were talking about a very particular group of young people. And Amanda, I noticed a question there for you about if people were interested in getting further information about gender differences in the My World survey.
Yeah, so throughout the whole report, we've ran the gender differences, and it gives a better understanding of the differences that we see between male and females. And in some factors, females are scoring higher in protective factors, like they're more likely to seek support, they're more likely to talk to their peers about their issues. And in other ways, we see that females might be maybe engaging more avoidant coping and so on. So we see very clear gender differences in certain variables, but that's throughout the whole report. Okay,
thanks, Amanda. Rachael, there was a question for you. Again, I can see you have answered this, but just about NCYI being involved in talking to the Department of Education about young people's mental health. Is that something you've been able to do?
Yeah, the Youth Council, we work specifically with the out-of-school sector. We don't work with the educational departments. So that would be different organisations like Jigsaw. The HSA would be very much involved in mental health within the educational department, but for us specifically, we're the out-of-school sector.
Okay, thanks, Rachael. And then finally, I'll just ask any of you who would have any advice for Leaving Cert students is one question. So maybe, I don't know if you each would have a comment there.
Yeah, I'd just comment on one thing that I suppose, like, there is research, current research showing that young people, are really, they miss school, and particularly, I suppose, with the Leaving Cert here, it's about another thing that's coming up for Leaving Cert students is that they're feeling pressure to try and do this work themselves at home and so on. So linking in with teachers, the teachers at the moment are very open to how they can support young people and maintaining those lines of communication open. So if the young person needs support in a certain way, telling the teachers, talking to them, linking in with them, saying what's working for them, what's not. I suppose for a parent to try and, again, that acknowledging that this is, a distressing time, trying to study for their Leaving Cert, try and motivate them, try and support them in whatever works for them. Again, as Geary says, like, it's that negotiation between parents and the young person, what's going to work for this young person. But particularly teachers are saying that they want to hear from young people about what's working and not. Teachers are also learning how to work in this whole new environment. So I think that link between the young person and teacher could be very supportive for the young person at this time.
Thanks, Amanda. Would anyone else like to add to Amanda's answer there?
Yes, I would like just to follow up from Amanda, and that this actually taps onto the establishing this positive relationship with a teacher, like connecting with teachers, also enhances the sense of connectedness with school and the sense of belonging, which is really important, especially in this period, because young people are not physically in their physical environments where they feel the connectedness. So we should consider how this can, how they can feel this through this, during actually this situation. So sharing this, talking with the teacher, and also sharing all these kind of emotions and anxieties and concern with the parents is really, really, really important for both sides, both for parents, because we should acknowledge that parents also must be very, very stressed at this particular time, and their children's worries are also their worries.
Thanks, Niki.
I just add to that, Eilis, maybe that I think one of the difficulties with this question is that no one knows what's the right thing for us to do. Should we go ahead with Leaving Cert? Should we not go ahead with Leaving Cert? Is that a good or a bad thing? And I think we're just left with that uncertainty. So in a way, this is something that's, I think, unresolvable. And I think young people have different responses. Some people want to do it, some people don't want to do it. And if we don't do it, well, then it has big implications of delaying your what happens to you after school. So for me, I think the first step is to acknowledge we don't actually know what's the best thing to do, and we'll try and work out what the best solution for any given young person might be. So for a parent and a young person, maybe sit down and talk that through and try and work out what's the best response for them. What, given where we are, what would they like to happen? And to remember that there will be other options too. If things don't quite work out in the way that you might have hoped this time, it's not necessarily, it's not the end. There will be other opportunities to work out better other steps in the future, whatever they might be.
Okay, thanks, Gary. I don't know, Rachael, did you want to add anything there?
Yeah, I suppose just the one other piece that I would say is it's just to give the young person that opportunity to really say how they're feeling in all of this, to give them that space, as much space as they need, just to kind of verbalize their feelings and what's going on for them. And as Amanda said at the very start, the importance of linking in with the teachers, because the teachers are there to provide that support, and they're open to try and interact with the young person again. So yeah, just as long as they're communicating and trying to connect in, I think that's all we can really do, because as Gary said, nobody knows what's going to happen. So it's kind of the unknown at the minute.
Thank you very much,
Rachael. Something before we, just a minor comment if we have some time. So if we look back at the studies from the SARS outbreak, so that go 10 years back, what we know is that young people, especially those who were interviewed and asked about their lived experience of this outbreak, what they were telling was that they need more effective communication channels. And I think that captures all the issues that we may have been considering about how we can deal with this unknown situation. So that I just wanted to add this final comment about this communication channel. So maybe we need to focus on, in different ways, on facilitating these communication channels.
Thanks, Niki. And of course, communication and the ability to communicate in a variety of different ways has moved on a lot since SARS. Okay, well, then at that point, we're just out of time. So I would like to extend a very warm thank you to our 4 fantastic speakers this morning. I'm very grateful to you all for giving up your morning, for putting in so much time, and indeed to Geary for organising this whole series of seminars about the response, social sciences in response to the COVID-19 crisis. My apologies if there hasn't been a chance to get to any specific question that you had. We had a lot of them. Just to also say that we have had a lot of very positive comments on the presentations this morning. So it's not just me who thinks that it was really fantastic set of presentations. So thank you all very much indeed. Just to repeat that if anybody missed any of the speakers this morning, you will be able to get a recorded version of today's seminar on the UCD Geary website. Thank you all very much, and goodbye.
Thanks. Bye.
Bye. Bye. Bye.
Thanks, everyone.
Bye.
Bye.
Bye. Bye.